Morning to all. Topic for today's discussion is on treatment plan. What is treatment plan basically? Treatment plan is nothing but it is a blueprint for case management. It includes all the procedures required for establishing and maintaining the oral health of the patient. So, before going into the phases of treatment plan, we will see certain conditions or situations where we extract the tooth then and there, and certain situations where we can postpone the extraction to some other date. So extractions are done in the following situation. The tooth is so mobile that the function becomes painful. The tooth can cause an acute abscess in the treatment, and there is no use of that particular tooth in the overall treatment plan. So in these situations, we extract the tooth immediately. Whereas in certain situations, like the tooth is acting as a posterior stop, the tooth maintains the posterior stop and also remains functional after the implant placement in adjacent areas. So when the implant is restored, the teeth can be extracted. Also, the tooth is present in the anterior aesthetic region, and during periodontal surgical procedure in the adjacent region also you can extract it. So these are situations where extraction is postponed to some other date. Coming to the phases of treatment plan. We have 4 phases in treatment plan, the starting of which is the preliminary phase, also called as emergency phase. Here, emergency treatments are carried out. For example, pain is an emergency. So, the reasons for pain, for example, dental or periapical infections, as in case of a deep dental caries with pulpal involvement. So, we do an emergency access opening in the emergency phase. And periodontal related abscesses, so abscess drainage, and also other treatments like extraction of hopeless tooth. These are the main treatment options which comes from the emergency phase of the phase of treatment plan. So, coming to the first phase or phase 1. Phase 1 is also called as etiologic phase or non-surgical phase or initial phase or cause-related phase. So the treatment options comes are, I'm giving a mnemonic, horse and more. That is habit counseling, oral hygiene instructions, scaling and wound cleaning, excavation of caries and temporary restoration, antimicrobial therapy, MOP, that is minor orthodontic tooth movement, occlusion therapy, provisional splitting and prosthesis, correction of prosthetic or restorative irritation factors. After all the above treatments, we re-evaluate response to phase 1. Re-evaluation of, that is rechecking of pocket depth and inflammation, any plaque, calculus, caries. Normally, after the phase 1, re-evaluation is done after a period of 3 weeks. So after the phase 1, next is the phase 2, also called as surgical phase, in which we do periodontal surgeries, both major and minor surgical procedures, endodontic surgery, that is RCTs, implant placement, and also extractions of teeth. After the phase 2 comes phase 3, also called as a restorative phase. Restorative phase, we give final restoration, that is FPDs, RPDs, CDs, all the processes. Then restoration, that is permanent fillings can be given. Then after an RCT treatment, the tooth can be given a crown, that is also a permanent restoration. Then fixed orthodontic therapies. These are the treatment options which comes under restorative phase. Then we have a maintenance phase, also called as supportive periodontal therapy. In maintenance phase, we do a periodic rechecking of pockets, gingival inflammation, plaque, calculus, caries, gingival condition, occlusion, mobility, and other pathological changes. So, what's the sequence of periodontal? Is it just starting from phase 1 to phase 2, phase 3, phase 4? No, it is not that like that. It is actually a sequence of events, initially starting from an emergency phase or the preliminary phase, like a cycle. After which we go to the phase 1 or non-surgical phase. Then we re-evaluate the patient or put the patient in maintenance therapy. After maintenance therapy, we go to the surgical phase and see again after the surgical or phase 2, we go back to the maintenance phase. Then we have the restorative phase or phase 3, again the phase 4. So which means the maintenance phase or the phase 4 is coming after every phase of treatment plan. So this is the sequelae of periodontal therapy. Now coming to SPV. What is the need for or rationale behind recalling the patient or supportive periodontal therapy? There are several reasons. The most important of which is, we all know periodontal disease is a recurring one. There are many factors for which. One is incomplete subgingival plaque removal. How much ever we do a scaling and root, some amount of local factors can be persisting in the subgingival area, which can lead to recurrence of periodontal disease. So we have to reevaluate the patient. Secondly, the bacteria which is responsible for periodontitis is basically aggressive and some form of chronic are tissue invasive, which means they will be present in the tissue subgingivally always. So they can reinfect the tissues. So we have to reevaluate and remove all the subgingival calculus. Thirdly, we all know healing after periodontal therapy is normally by formation of something called as long junctional epithelium. This long junctional epithelium is weak attachment. Weak in the sense there are chances for recurrence of pockets because it will break down in the presence of periodontitis. So that is another reason. And also finally, although our pocket debridement suppresses the components of subgingival microflora associated with periodontitis, pathogens can come back to the baseline levels within few days or months. So that is another reason why we have to recall and reevaluate the periodontal health of the patient after every phase of treatment. Now, do we have any particular classification for when to recall the patient? Yes, it is called as Merens classification in supportive periodontal therapy. So according to Merens classification, we can categorize the patient as first year patient and after the first year. So first year patients, we can recall them in two ways, either once in 3 months or in once in 1 to 2 months. When do they recall? Once in 3 months, if the patient has come for routine therapy and healing is uneventful. But if the first year patient is a difficult case with complicated processes, with vocation involvements, with poor crown to red root ratio and questionable patient population, then we have to evaluate them once in 1 to 2 months. Now the patient has completed the first year. After the first year, the periodontal treatment and recall of the patient will be as Class A, Class B, and Class C patients. Who all are Class A patients? Class A patients are good patients, that is excellent results, well maintained for 1 year or more. Patients having good oral hygiene, minimal or no calculus, no occlusion problems, no complicated processes, no remaining pockets, or no teeth having less than 50% annual bone decay. We need to recall them only after 6 months, so 6 months to 1 year. Now, Class B and Class C patients are those patients have some issues which are persisting. For example, Class B patients have inconsistent or poor oral hygiene, heavy calculus, systemic diseases present, some pockets remaining, occlusal problems are present, complicated processes is there, ongoing ortho treatment, recurrent caries, some teeth having less than 50% bone support, who is a smoker, more than 20% of pockets bleed on bone. These patients are recalled in 3 to 4 months. And Class C patients are those who need to be recalled every 3 months. Why? Because these patients have generally poor results after the periodontal therapy because many negative factors are there. All the factors are in a worst condition. For example, heavy calculus, very poor or inconsistent oral hygiene maintenance, systemic disease, complicated processes, occlusion problems, many pockets remaining, many tooth having multiple bone loss, and patient who's a smoker, and also having a positive family history and many tooth or many pockets, that is more than 20% which bleeds on bone. So based on this, categorize the patient as first year and after first year patients. That's all for today's lecture. Thank you.